Hi, Tim.
Yeah.
Hi, my name is Maggie. I'm a family nurse practitioner student. How are you?
How are you doing?
Good, good. What brings you in today?
Just trying to set up like a primary care doctor.
Okay, alright. Well, I'll be performing a general health history on you as well as a family history. If that's okay with you, and anything that we go over will be confidential. It'll take about 10 to 15 minutes to talk through these things, okay? How are you feeling in general today?
Fine.
Good, okay. And do you have any allergies to food or medications?
Fish and shellfish, and it doesn't come up often, but Cipro.
Fish, shellfish, and then Cipro. You're allergic to Cipro.
Yes.
Okay. What happens when you take Cipro?
Honestly, don't remember. It's
Were you a
I was-
child?
yeah, it was maybe 5 or 6 years old.
Okay. Do you know if it was a rash, or did somebody just tell you you're allergic to it, don't take it?
I honestly
Okay.
can't tell you. I don't
Okay, well, we'll put it on there to be safe. Do you take any medications currently?
No.
Nothing. Over the counter? Any supplements?
Not really.
Okay. And do you have any medical history? Anything you've been diagnosed with?
Sleep apnea. That's it.
Sleep apnea. Do you use a CPAP machine
Yeah.
at
Every
home? Use it every night? Okay. What year were you diagnosed with sleep apnea?
2019.
Okay.
It's,
And what about surgical history? Have you ever had surgery?
I had a broken ankle maybe 12, 13 years ago.
Okay. Which ankle was that?
My right foot.
And you had surgery for it? Okay. What about your family history? Any significant family history on your mom's side, dad's side? We can do your mom's side first.
Sure. My grandma on my mom's side was a smoker. She developed lung cancer.
Okay.
On my dad's side, my grandma had 1 or 2 strokes, but otherwise she's healthy. She's 89.
That's your dad, your dad's
Dad's side, my dad's
mom, your paternal
Um,
grandmother.
and
Okay, and then on your mom's side, anything with the grandfather?
My mom never knew him, so.
Okay. And they're living?
No,
No, those are deceased. And then your mother is living.
my mother's living.
And is she healthy? Does she have any medical
Yeah,
concerns?
she's had a history of like bronchitis, but nothing more than that.
Okay. And then your dad and his side?
So my grandma on my dad's side has had a stroke in the past. My grandfather had Alzheimer's. My grandmother is still alive. My grandfather died last year.
Okay. And your parents are both living?
Yeah.
How old are they?
My mom's 56. My dad just turned 60.
Okay. And your dad is healthy as well? Any
Yeah.
diagnosis?
Honestly, he has high cholesterol. I honestly don't remember, but I think so.
Okay. Alright, anything else you can think of in your family of significant?
No, but
You
I
have,
have an aunt with lupus. So
Okay.
that's about it.
do you have any siblings?
I have a brother. He's healthy.
Healthy, okay. How old is he?
35.
Okay, and describe your current living situation.
Married. I have a toddler at home.
Okay. You live in a house, apartment?
Yeah, we purchased a house.
A house, okay. What's your highest level of education?
Bachelor's.
Okay, and do you currently work?
Yes.
What do you do for work?
A district manager for a rental company.
Okay, alright. What would you say about your stress levels?
toddler at home can be stressful.
Yeah.
Work has its moments, but scale of 1 to 10, probably like a 3 or 4.
Okay.
Honestly, pretty like that.
Okay. Good. When you're not working, what are your hobbies?
When it's warm out, I spend a lot of time out gardening, doing artwork. So I just have a lot of time with my daughter, so it's playing.
And do you feel like you have a good support system at home and with your family?
Yeah. So,
What about exercise? Do you exercise? Are you active?
walk the dog a couple times a day. My job is very physically active. Probably walk upwards of 6-7 miles a day.
At work, just at work.
Just
Okay.
at work.
All right. Do you smoke or have you ever smoked?
No.
Do you drink alcohol?
Like once or twice a week I'll have a beer with dinner.
Okay.
I've never done anything crazy.
Okay. 1 to 2 times a week then.
Yeah.
Any recreational drugs?
No.
Okay. Have you had any recent pains or new fevers, chills, overall symptoms?
No. Once in a while, like I'll overexert myself and my ankle might hurt, but I mean, that's
Okay.
after a couple of stretches it goes away. So
Yeah.
nothing chronic, I would say.
What about, have you had any unintentional weight loss or gain in the last few months?
No,
Okay.
nothing that would be concerning or
Eating okay?
noticeable.
Sleeping okay?
Yeah.
Things like that.
Yeah. Again, toddler at home, so live on her schedule. So.
Right. Okay, so we're just going to go through some body systems then. I'm going to start with your hair and skin. Do you have any new rashes, itching, any skin changes that you're concerned about as far as your skin?
No.
Nothing like that. Okay. Any headaches, dizziness, symptoms like that you get?
No. Headaches are pretty rare.
Okay. Do you have any history of concussions?
I've had a concussion.
What year was that?
2005, maybe.
Okay. No lasting symptoms from that?
No.
Have you ever lost consciousness?
No.
Any vision changes, blurred vision,
No.
nothing like that? Okay. No concerns with your eyes? What about hearing loss? Any ringing in your ears?
No.
Trouble hearing?
No.
No. With your nose, any nosebleeds, sinus issues?
No. Like maybe once a year, the height of summer, nosebleed. Nothing.
All right. Any trouble swallowing? Anything you've noticed with your throat? Yeah. And if you've noticed any swollen lymph nodes? These are on the side of your neck here. Nothing that you've noticed. Okay. What about your lungs? Have you had any cough, wheezing, shortness of breath? Anything
No.
like that? No. You said you have sleep apnea and you do use your CPAP. Any trouble with that? How is that going well for you?
Yeah, so I've been using it for a little over 4 years now, and my job actually requires us to share records of our usage with them, so I've gotten accustomed to it. It's not always the most comfortable thing, but I feel like
Okay.
I do sleep better with it.
Okay. And nothing else going on with your lungs? No asthma, COPD? Never been diagnosed with anything like that? All right. And anything with your heart? Have you ever had checked out your heart for chest pain or
Never had any issues.
ever had palpitations?
No.
Have you ever been diagnosed with high cholesterol or high blood pressure?
I have not. Last time I went in for a physical, it was told to maybe start looking into getting it checked out just because it was.
For your blood pressure,
Yeah,
it was a little
well,
elevated.
Yeah, it was a little on the higher end.
Oh,
It was
okay.
Still passed.
Okay, we can follow up on that today and see how it's looking. Do you take it at home at all, or
Do I
take your blood pressure?
No.
Oh, okay, so it was just at the one appointment it was high.
Yeah.
Okay.
Sometimes I get nervous at the doctor, so
Okay.
that could have been it. I don't know.
We'll see what it is today then. All right. Any issues with your stomach? Any abdominal pain that you've had? Digestion issues?
My occasional heartburn.
Okay. Do you take anything for that?
I mean, other than Tums, not really.
Okay, Tums.
I mean,
Is it relieved with Tums?
yeah. I usually only take like one tablet instead of the two, and that's enough for me. And that's maybe once a week.
Okay. How many? Oh, you said once a week. You have the heartburn.
Yeah.
Okay.
It might be like just eating habits. I usually don't eat until about the time my daughter goes to bed. So.
Okay. All right. Any history of gallstones or jaundice?
No.
Anything like that? Okay. And then any trouble urinating ever, or urgency or frequency with urination?
No.
Any issues there? Okay. No history of kidney stones? You ever had a kidney
I'm
stone?
like unnaturally afraid of kidney stones, but I've never had an issue.
Any history of diabetes?
No. Actually, the last physical, they said it looked really good.
Okay. Good. And then with your skin, any new moles or concerning skin issues? No. Okay. Any joint pain or restriction of movement? I know you said you have some pain in that right ankle.
Yeah. Again, that's only a couple times a year. Other than that, no.
No other
Full range of motion.
joint injuries or weakness in any of your muscles? Right. Any history of sexually transmitted infections or history of testicular pain, or have you ever had an abnormal testicular exam? What about, have you ever had dizziness or numbness and tingling in any of your extremities, your arms and legs?
No, like other than falling asleep on my arm or foot
Right,
or something.
right.
No.
Ever have any issues with your memory that's concerning to you?
My wife says in general I have a pretty bad memory.
Well,
But
we get that a lot.
no, I don't think so.
Do you have a history of seizures or anything like that? Tremors, paralysis? Okay. Have you ever had abnormal bruising or bleeding that you've been concerned about?
No.
Any, ever have any blood clots?
No.
What about a blood transfusion? Have you ever had a blood transfusion? Okay. All right, and then have you ever had any feelings of depression or been diagnosed with depression?
I've never been diagnosed with anything. Maybe back in high school I had feelings of depression, then
Okay.
20 years ago.
And no recent feelings of
No.
depression? Any mood changes lately?
No.
Difficulty falling asleep or staying asleep?
I don't have any problems sleeping.
Any suicidal thoughts at all? And ever have difficulty concentrating or anything like that?
I don't think so.
Okay. All right, that sums up all of the body systems. Just to review, you're pretty healthy, you have sleep apnea, no significant family history, a stroke on one side, and some Alzheimer's also on one side. As far as your systems, you just have the right ankle surgery and pretty much in good condition. Do you have any concerns that we didn't discuss that you wanted to discuss today?
I don't think so.
Okay. All right, well, thank you for your time, and if you think of anything, go ahead and reach out. Okay.
Thank you.
All right, take care.